Dr. Howard Rollins with EHR TV. I'm here at HIMSS 2012 with Teecie Cozad of Merge Healthcare. Hi Teecie, thanks for being
with
us
Howard.
today.
Nice to be here.
So Merge does a lot of things, obviously. Big
Yes.
company, they do a lot of things really well. But
Yes.
we're going to focus on AIMS. Okay?
Right.
Tell me about the Merge AIMS. Tell me, for instance, how long has it been around? What's special about it?
The Merge AIMS actually has been around for a while. It's tried and true, which is significant in this industry because with anesthesiologists and their clinical records, they are somewhat paranoid about things going wrong. It's part of their culture. So the fact that this has been tried and true in hospitals around the country is very helpful
But
and
market
reassuring
penetration
to
has
them.
been very low until recently. I think with all the health information technology revolution, if you will, things are starting to pick up a bit, right?
Yes, they are. The anesthesia information management system has been around probably for 25 years with a market penetration that has been bordering on 10% for a long time. That actually by now is moving to a 15 to 20% penetration, which still leaves a lot of room for growth, but is starting to take off. I think primarily as hospitals start getting EMR implementations under their belt, then they're moving into the more special areas like anesthesia.
I know that the penetration is much greater in the academic practice, but I know a lot of clinical anesthesiologists that really don't know what AIMS is and what it can do.
Right, and if anesthesiologists in community hospitals, which by the way is one of our sweet spots, if they don't go to meetings like HIMSS or the American Society for Anesthesiology, they may get left out and not know what's happening in the industry.
You said it's one of your sweet spots, private practice. Tell me why.
Because our anesthesia system is meant to work the way anesthesia providers work at a very rapid clip. In academic centers, they don't necessarily operate at the same fast pace. But in community hospitals, throughput is everything.
So workflow is not really interrupted, but is it actually enhanced?
It is actually enhanced. We can actually help an anesthesia provider document a case, especially short cases, much faster than they can on paper. And the reason I say mostly short cases is that's where it really counts the most.
Right.
When you have a quick, rapid turnover environment to be able to document exceptionally well in a small amount of time.
And why can Merge do that?
We have a workflow and system that really is modified to work the way the provider works in that particular institution. It's a very configurable system, easy to use, bam, 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 bam. And so that works out really nicely. Besides that ease of use, something that's important more so to the hospital than to the anesthesia provider is our ability to talk to other systems.
So when a physician or a facility makes the commitment to get an AIMS solution for their operating room, one of the things I hear a lot is implementation. How long will this take? Is this going to disrupt the flow of work in the operating room? Are cases going to be delayed? Are we going to have problems? How is it handled with Merge?
Implementation is really a set of events that occurs over a period of about 5 months. And that occurs outside of the ORs. The only thing that occurs in the ORs is the transition of equipment, adding that in, and we have immediately thereafter a mock live in which we test the system in 1 or 2 ORs. And then thereafter we go live. So we're ready to go. Most clinicians find that if they see a case and do a case, they've got a pretty good handle on how to create a record.
Who is there when you go live? Are there people from Merge at the very
beginning?
Always.
And we take a whole team of folks with us to a site, and depending on the size of the site, it will be anywhere from 3 to 6 or even 9 people.
How does it go usually?
It goes great. Always to the surprise of the clinicians. It generally goes off without a hitch.
We were talking about interfaces a little. With whom can the Merge AIMS interface? What other departments, what other facilities?
In terms of other departments, we have standard interfaces for the lab, admissions, discharge, ADT systems, surgical scheduling. We send information outbound to pharmacy and materials management for charging. We'll send information out to the anesthesia group's professional billing company for professional fee billing. And the trickiest part to that is interfacing with clinical systems like the EMR, but we do a nice job of that as well.
So, all said and done, tell me why I, an anesthesiologist, should buy Merge.
We have a very nice, easy to use system which will not detract from their workflow. Most importantly, it allows them to focus on the patient and not on the record. We also interface with all of those systems. Many companies say they can, but have a little difficulty doing that. And we have some unique capabilities with our system. The ability to capture information from the patient from home about their health history.
Tell me a little about that.
We have a product called the pre-surgical solution, which allows patients either from home or from a surgeon's office, or if they need some help from the hospital surgery clinic, to be able to answer questions about their health history. Separate questionnaires are supported for a pediatric versus an adult versus an obstetric patient. So we take that information from the patient and we feed it through a series of algorithms and actually help the hospital and the anesthesia staff to triage those patients in advance of surgery. Find out who needs to come in, who doesn't need to come in, who needs to be seen in advance, who doesn't, what kind of tests do they need. All of that becomes part of an algorithm.
How about the schedule, the central scheduling of the operating room on a given day? Is there a central board that can be used?
Yes, we call it an electronic whiteboard, and it's driven as a side effect, really, of routine documentation. So it's not
Is it touch screen?
There is a touchscreen application on a desktop,
I see.
but the big board, typically the plasma screens are not touch capable, and nor do they really need to be.
Right.
But
They're often out of reach anyway.
That's right. The status of the patient changes as patients roll through the OR, so it's a nice, really helpful way to help maintain good throughput, know what's coming down the pack so that you can prepare for it.
Thanks. One last question. Clinical decision support. Can you speak to that a bit?
Yes, the Merge HIMSS has a robust engine for decision support. It's the Microsoft Logic system, and it's very configurable. So we can help a group improve their record keeping by well-placed prompts for the clinicians as they're documenting. We can also look out for safety. We can provide information in advance of drug delivery about the patient and which drug you're about to deliver through a series of barcode scans. So there's a lot of capability for improving safety, meeting quality objectives for the hospital and the group, and ultimately getting data out of the system. That's a very key component.
Right. Thank you very much.
Thank you, my pleasure.
Very nice talking to you.
Nice talking to you.
Teecie Cozad with Merge Healthcare. Thank you.